Book summary: Nudge, Improving Decisions About Health, Wealth, and Happiness. Author: Richard Thaler and Cass Sunstein. Chapter 1: Our Mistakes. Have you ever seen two tables with different shapes but the same length? Our brains are easily deceived. This is how Chapter 1 of Nudge begins, showing that humans are not perfect. Unlike econs, the super-rational beings in economics textbooks, we are humans who often make mistakes due to quick and emotional thinking. For example, when asked in what year Attila invaded Europe, you might guess based on your phone number. This is the anchoring effect, where random numbers still haunt our judgments. Or when we fear plane crashes more than heart disease, simply because crashes are often in the news, this is the availability heuristic. What is easily remembered makes us overestimate its likelihood. Another trap is the representativeness heuristic. Hearing that Linda is smart and loves justice, many guess she is a feminist activist, even though the probability of her being a bank teller is higher. We are led by what sounds right, ignoring actual probabilities. Humans are also overly optimistic, thinking they drive better than average, and often lazy to change, like sticking with an old retirement fund. The way information is presented also matters. 80% fat-free is more appealing than 20% fat. From these biases, the concept of nudge emerges, small changes in how choices are arranged. For example, placing fruit at eye level in the cafeteria helps us eat healthier. A nudge doesn't force, it just cleverly guides us toward better decisions while still allowing complete freedom of choice. Chapter 2: Resisting Temptation. The authors discuss how humans often struggle with self-control and easily make wrong decisions like overeating, overspending, or procrastinating on saving. They start with the cashew nut example. When guests kept eating, the host had to remove the bowl to prevent them from overindulging. This illustrates time inconsistency. We want to choose what's good for the future but are tempted in the present. Thaler and Sunstein explain this with the concept of two psychological states, hot and cold. In the hot state, like when hungry or stressed, people are impulsive. In the cold state, we are more rational and plan better. However, in the cold state, we often underestimate the power of future emotions, called the hot-cold empathy gap. The two-self model is introduced, the planner, representing reason, and the doer, representing instincts and emotions. The conflict between these two selves is at the core of self-control issues. Some tools are proposed to support the planner, such as mental accounting, dividing money into jars to control spending, or commitment devices, automatically deducting savings, blocking social media, or setting behavior limits. A typical example is the Save More Tomorrow program, where workers commit to increasing savings after each pay raise. This is a smart nudge that leverages the status quo bias to promote positive behavior without coercion. This chapter shows that understanding our weaknesses is the first step to designing environments that help us live better. Chapter 3: Following the Herd. Humans do not make decisions in complete isolation. We are social creatures who often observe and imitate others' behavior. Thaler and Sunstein explain how social influence shapes individual choices and how nudges can leverage this to foster positive change. A classic illustration is Solomon Asch's experiment. When others intentionally choose the wrong answer, participants often repeat the mistake, even when they can see the correct one. This demonstrates the power of group pressure. The authors emphasize that if people believe everyone is doing it, they tend to follow suit. When media campaigns highlight that most citizens file taxes on time, compliance spreads. However, if they inadvertently emphasize that many people cheat, it can backfire, making people think wrongdoing is the norm. This is called the boomerang effect. When negative information is overemphasized, it legitimizes bad behavior rather than preventing it. A successful example is the Don't Mess with Texas campaign. Originally aimed at reducing roadside litter, the slogan didn't use regulations or fines but tapped into local pride, touching on Texans' strong identity. The message was so effective that roadside litter decreased by 72% in just a few years, showing that a smart nudge can change behavior on a large scale without coercion. Chapter 4: When do we need a nudge? Not always do humans need a nudge. But in many situations, especially when decisions are complex, rare, lack clear feedback, or have delayed benefits, we are prone to errors. Chapter 4 explains why and when a nudge becomes necessary. Humans are not good at handling messy information. In major but infrequent decisions, like choosing a mortgage, retirement plan, or insurance package, we often rely on intuition or procrastinate, leading to suboptimal choices. When weighing present versus future, like dieting or saving, the separation of benefits and costs over time makes us lean toward immediate rewards. The authors point out that many people don't enroll in retirement plans not because they don't want to, but because the sign-up process is cumbersome. A simple nudge, like default automatic enrollment with an opt-out option, can significantly increase savings rates without forcing anyone. In consumer environments, where information is asymmetric and companies have incentives to exploit customers' behavioral weaknesses, nudges play a corrective role. For example, when insurance providers design confusing comparison tables, people need a more transparent and intuitive environment to avoid being shortchanged. This chapter also introduces the concept of asymmetric paternalism, gentle interventions that help those prone to errors without bothering others. This is the spirit of nudging, respecting freedom of choice but cleverly guiding toward better decisions. In summary, nudges don't replace choice but make choosing correctly easier, especially when humans fall into the danger zones of procrastination, overload, and cognitive biases. Chapter 5, Choice Architecture. Have you ever stood in front of a store shelf, overwhelmed by too many options, and randomly picked something not great? Thaler and Sunstein call this the modern consumer's problem, not a lack of freedom, but too many unguided choices. Chapter 5 introduces a smart solution, choice architecture, arranging the environment to guide behavior beneficially without coercion. The authors start with an example from a school cafeteria. Simply placing fruit at eye level makes children choose it more. No regulations needed, just clever design. 6 principles of effective choice architecture are presented. First, incentives, clarifying who benefits, like air conditioners displaying energy consumption to encourage users to save. Second, mapping, helping users understand what their choices will yield, such as describing photo sizes instead of just megapixels. Third, defaults, what happens if no choice is made? A good default, like automatic enrollment in a retirement fund, can make a big difference. Fourth, feedback, providing immediate information to adjust behavior, like a camera showing the photo right away. Fifth, error prevention, designing so users can easily correct or avoid mistakes, like a gas cap that can't be placed on the wrong side or a stove that shuts off automatically. Sixth, simplifying complex choices, for example, a paint store grouping colors into memorable categories instead of technical codes. Thaler also mentions the black fly painted on urinals at Schiphol Airport. Just a small change reduced spillage by 80%. At the end of the chapter, the authors warn that if not designed carefully, choice architecture can be abused, like defaulting users to receive marketing emails. Therefore, choice architects need to be transparent and ethical. Chapter 6, Save More Tomorrow. Many people promise to save but spend everything when they get paid. In 2005, the personal savings rate of Americans fell into the negative for the first time since the Great Depression. They spent more than they earned, borrowed from credit cards, and didn't invest for the future. The reason isn't necessarily ignorance but behavioral barriers, procrastination, resistance to change, and loss aversion. Thaler and Benartzi developed the Save More Tomorrow program to help people save without immediate sacrifice. Participants commit in advance that when their salary increases, a small portion of that increase will be automatically transferred to savings. This avoids the feeling of loss and leverages behavioral inertia. The program was first tested in 1998 at a manufacturing company. Those who didn't want to increase savings immediately were invited to join this plan. Each time their salary increased, their savings rate would increase by 3 percentage points. The results were impressive. Their savings rate rose from 3.5% to 13.6% after 4 pay raises, higher than those who were advised to increase by 5% immediately. The program's success spread. By 2007, 39% of large U.S. companies had adopted automatic savings increases. The federal government also got involved. The Pension Protection Act of 2006 encouraged businesses to use automatic enrollment and gradual contribution increases, in exchange for exemption from some complex procedures, a true nudge. The message is clear: if designed correctly, saving doesn't have to be a difficult decision. Workers don't need to choose each step, they just need to agree initially. The system handles the rest. A clever nudge can turn a good habit into the default. Chapter 7: Naive Investing. Investing isn't just about numbers, it's a battle with our own psychology. In this chapter, Thaler and Sunstein show that most workers aren't rational econs but emotional humans, and those emotions often lead to naive investing. A common mistake is overconfidence. Investors often think they can control the market, trade frequently, but usually end up buying high and selling low. Loss aversion also makes many hold on to losing stocks, as selling means admitting a mistake. Another naive behavior is investing too much in the company where they work. Despite the high concentration risk, many do so out of loyalty or familiarity. To address this, programs like Sell More Tomorrow allow gradual diversification away from company stock. The authors propose a series of nudges to support amateur investors. One is defaulting workers into target date funds based on their retirement date, with risk decreasing over time. This approach provides a suitable portfolio without requiring deep financial knowledge. Additionally, automatic rebalancing is a helpful nudge. When markets fluctuate, the portfolio self-adjusts to a rational allocation without manual intervention, preventing emotional drift or neglect. Some companies even design a 3-tier system. Those uninterested can stick with the default, those who want to choose have a few suggested options, and those confident can adjust the entire portfolio. In conclusion, naive investing isn't an individual fault but a result of an unfriendly system. With smart design, the right nudge, we can help millions invest better and safer without needing to become experts. Chapter 8: Credit Markets. Mortgages, credit cards, or student loans, all are major financial decisions that consumers often approach in confusion. In this chapter, Thaler and Sunstein show that even highly educated people can be misled by hidden costs, vague language, and confusing choice designs in credit markets. With mortgages, borrowers face various types like fixed rate, adjustable rate, teaser rates, prepayment penalties, and hundreds of unclear fees. A study found that even MBA students struggle to choose the best loan in a simulation simpler than reality. In reality, the poor or uninformed are easily lured by brokers into unfavorable loans. Student loans are no better. The federal aid application process through FAFSA, with hundreds of questions, causes many students to give up and turn to private loans with high interest. Some universities even partner with lenders to promote disadvantageous loans. Credit cards are widespread but debt-inducing. Millions of Americans carry over $12,000 in credit card debt, with interest rates often exceeding 18%. Default designs like minimum payment make users unaware of the massive interest they're paying. Late fees, foreign transaction fees, and penalties are hidden in hard-to-read fine print. The author's solution is RECAP, short for record, evaluate, and compare alternative prices. For mortgages, credit cards, and student loans, RECAP demands transparent cost disclosure in an easy-to-understand, comparable way. Instead of forcing, RECAP helps users make informed decisions through smart design. This chapter shows that in a financial world full of traps, nudges don't prevent us from choosing wrongly but make it easier to choose rightly, and that's the most important protection of individual freedom. Chapter 9: Privatizing Social Security. In 2000, Sweden implemented a buffet-style social security reform, allowing citizens to choose up to 5 retirement investment funds from a list of over 450. Those who didn't choose were automatically placed in a state-designed default fund. The government encouraged active choice through a massive advertising campaign. Initial results: about 67% of participants chose their own funds, largely influenced by advertising and past performance, especially hot tech funds. One prominent fund, Robur Aktiefond Kontura, had risen 534% in the 5 years before the reform, attracting many investors, but then lost 69.5% in value over the next 3 years. Those who chose their own portfolios tended to invest 96% in stocks, with a bias toward Swedish companies, home bias, and rarely chose index funds, only 4.1%. They paid nearly 5 times higher fees, 0.77% versus 0.17% for the default fund, and suffered greater losses, minus 39.6% versus minus 29.9%, in the first 3 years. The authors criticized the maximized choice strategy, arguing that too many options overwhelm people, leading to systematic errors like availability bias, herding, and status quo bias. Meanwhile, the default fund, carefully designed, low-cost, and diversified, performed better and was rated 5 stars by Morningstar. Thaler and Sunstein argue that freedom of choice is only meaningful when paired with smart design. For the US or other countries, the lesson is to limit the number of choices, provide sensible defaults, and support people with transparent information, in the true spirit of an effective nudge. Chapter 10, Prescription Drugs, Part D for Daunting. This chapter analyzes Medicare Part D, the U.S. prescription drug insurance program, as a vivid illustration of how confusing choice design can bewilder people, especially the elderly, leading to wrong decisions. With dozens to hundreds of plans per state, varying costs, inconsistent formularies, and the donut hole, a coverage gap, choosing becomes a maze. Even when narrowed to 4 equally valuable options, 2/3 of seniors still chose suboptimal plans, showing they struggle to connect choice information with actual drug needs and risk tolerance. Experts and doctors also admit the program is too complex, while surveys show over 70% of users want the government to pre-select a few good plans for easier choice. A serious flaw was randomly assigning defaults to over 6 million low-income individuals, resulting in many being placed in plans that didn't cover their needed drugs, causing extra costs or discontinuation of medication. In contrast, Maine successfully used intelligent default assignment based on drug history, helping over 10,000 people switch to more suitable plans. The authors propose another nudge, recap, requiring providers to send detailed annual statements of drugs used and costs for each individual. This data would be integrated into a public, transparent price comparison system, making it easy for users to identify and choose more cost-effective, suitable plans. This chapter asserts, freedom of choice is important, but in complex situations like Medicare Part D, nudges, through intelligent defaults, clear information, and straightforward presentation, are the only way to protect users from costly mistakes. Chapter 11, How to Increase Organ Donations. In 2006, over 90,000 Americans were waiting for organ transplants. Most needed kidneys, but less than half of eligible donors actually donated after death. In this chapter, Thaler and Sunstein ask, how can we save thousands of lives without coercion? The answer, design the right nudge. In the U.S., most states use an explicit consent model, people must actively register. Although many say they're willing to donate, few actually check the box on their driver's license or sign a donor card. One emphasized solution is presumed consent, all citizens are considered donors unless they opt out. The difference is stark. In Germany, explicit consent, only 12% agree. In Austria, presumed consent, it's 99%. However, the authors note that implementation matters. In France, despite presumed consent by law, doctors still ask families, blurring the lines between the two systems. Another solution is mandated choice, requiring people to decide when getting a driver's license. They must check yes or no, no skipping. Though potentially less effective than presumed consent, this still increases donation rates and makes it easier for families to honor the decision. Illinois uses first-person consent. Once registered, families cannot override. The registration website also uses social norms, like 87% of Illinoisans believe in organ donation to positively influence behavior. This chapter shows that sometimes, just changing the default can save thousands of lives, while preserving freedom of choice. Chapter 12, Saving the Planet. Climate change and environmental pollution are urgent global issues. But can we change behavior without coercion? In this chapter, Thaler and Sunstein show that nudges, clear information, timely feedback, and smart design can effectively protect the planet with less controversy than coercive regulations. A notable success is the cap-and-trade program implemented in the U.S. since 1990 to reduce acid rain. Businesses were given limited emission rights and could trade them. The result, The program saved over $20 billion and reduced nearly 10,000 premature deaths annually. Additionally, simple nudges like visual energy feedback are highly effective. The ambient orb device glows red when using a lot of electricity and green when saving, helping households reduce peak hour consumption by up to 40%. Similarly, intuitive fuel efficiency labels on cars, instead of just MPG, help consumers understand costs and choose greener vehicles. Another impressive example is the Toxic Release Inventory, a public database disclosing companies' toxic emissions. Without rigid regulations, just naming and shaming on the blacklist led many companies to significantly cut pollution to avoid reputational damage and stock price drops. The authors also propose creating a similar greenhouse gas inventory to publicly disclose greenhouse gas emissions by state and company, thereby encouraging media and community oversight. From large policies to everyday behaviors, this chapter affirms that with the right design, small nudges can save the planet, while protecting freedom of choice. Chapter 13, Improving School Choice. We all agree that education is a fundamental right, but how can parents make the right choice for their children in a complex system? In this chapter, Thaler and Sunstein show that school choice only works when supported by smart choice architecture. In Worcester, Massachusetts, after 12 schools were rated poor for 2 consecutive years, nearly 5,000 students had the right to transfer. 6 months later, only 1 student exercised that right. The school system had inadvertently, or intentionally, softly discouraged parents from transferring by emphasizing obstacles, from lack of information to complicated transfer processes. In Charlotte, North Carolina, parents were given a 100-page booklet describing 190 schools but lacked core data like test scores, acceptance rates, distances, etc. A simple experiment, providing a summary table of average scores and acceptance rates for each school, helped parents choose better schools. The average score of chosen schools was 70% higher than the default. The authors emphasized the role of nudges, designing easy-to-understand comparison tables, personal counseling, and smart defaults like automatic assignment to nearby schools with the option to change. A notable example is San Marcos, Texas. Students had to apply to the local college to graduate. Result: the college application rate increased by 11 percentage points in just 1 year. Finally, Boston's controlled choice program, now improved with a strategy-proof algorithm, is evidence of design that prevents less informed parents from being disadvantaged. This chapter affirms, more choices aren't always better, what matters is ensuring everyone has the opportunity to choose correctly. Chapter 14, Should patients be forced to buy lottery tickets? Each year, there are about 85,000 medical lawsuits in the U.S., costing $11 to $29 billion. Doctors pay up to $100,000 or more for liability insurance, and these costs are passed on to patients through medical bills. Fearing lawsuits, doctors often practice defensive medicine, ordering unnecessary tests, avoiding beneficial but risky treatments, increasing costs and reducing care quality. Thaler and Sunstein call this system a medical lottery. Patients pay as if buying lottery tickets, most never win, get compensation, a few win big, sometimes without real harm. A New York study found that less than 2% of patients harmed by medical errors sued, while many compensated lawsuits lacked clear evidence of negligence. The authors propose a nudge, allowing patients to voluntarily waive the right to sue in exchange for lower treatment costs or other insurance. Currently, U.S. courts don't recognize such contracts, deeming them against public policy. But this denies freedom of choice. A patient might accept the risk to save costs, as long as they're informed and procedures are protected. Another option is a no-fault compensation system like in New Zealand, where patients receive fixed compensation for medical injuries without proving doctor fault. This reduces legal costs and eliminates the randomness in compensation awards. In conclusion, with transparency, choice, and smart defaults, the healthcare system can be fairer without forcing patients to buy lottery tickets in vain. Chapter 15, Privatizing Marriage. In this chapter, Thaler and Sunstein make a bold proposal: completely remove marriage from the law. Instead, the state only grants civil unions to any 2 people who want legal ties. Marriage would be left to religious organizations, communities, or individuals to define, thereby reducing social tension and respecting freedom of belief. According to the authors, state marriage is an outdated relic, once a tool to control sexual relations, childbearing, and property rights, but now unnecessary. People can have children, adopt, or live together without a marriage certificate. The state attaching both material benefits and symbolic value to marriage has created discrimination against same-sex or non-religious couples. The current system also imposes vague default rules, for example, who gets custody, who receives financial support in divorce. Even divorce lawyers don't know the outcome for sure. The authors propose designing clearer defaults, like the primary caregiver will continue to receive financial support or assets are split equally unless otherwise agreed, thereby nudging couples toward fair solutions, especially protecting women and children. Another nudge is encouraging prenuptial agreements, not mandatory, but helping couples clarify expectations and responsibilities from the start. The authors point out that irrational optimism makes most marrying couples believe they won't divorce, leading to neglect in preparing contracts, and this leaves many, especially women, disadvantaged after separation. This chapter ends with an important thesis: individual freedom must be respected, and a well-designed civil union system is the best way to protect love, property, and fairness. Chapter 16, A Dozen Nudges. Not all nudges require grand policies or complex system designs. In this chapter, Thaler and Sunstein list 12 small ideas, mini nudges, that can improve daily life from finance, health, to social behavior. A typical example is Give More Tomorrow, encouraging well-intentioned but procrastinating people to commit now to gradually increasing their donations each year. In one experiment, those who chose to delay 2 months before increasing contributions donated 32% more than those who increased immediately. Another related nudge is the charity debit card, a debit card used solely for charitable donations. All expenditures are aggregated by the bank and sent to the IRS to simplify tax deductions, making donations clearer and more attractive. For taxes, the automatic tax return proposal allows those without additional income to receive a pre-filled tax return to just sign and submit, saving billions and reducing errors. In health, the $1-a-day program pays teenage mothers $1 per day if they don't get pregnant, reducing unintended pregnancies at low cost. Additionally, Vitality Bucks rewards points for healthy behaviors like gym visits or normal health checkups, redeemable for airline tickets, magazines, or electronics. For personal behavior, Civility Check is software that warns when users are about to send an angry email. A stronger version requires a 24-hour wait before sending, giving the better angel a chance to intervene. Finally, small design tricks like a red light indicating a needed air filter change or bitter nail polish to stop nail biting, simple nudges with lasting impact. This chapter shows that instead of forcing, we can improve behavior just by helping people remember, understand, and act at the right time. Chapter 17, Objections. After presenting numerous nudge applications, the authors dedicate this chapter to addressing the most common objections to libertarian paternalism. 1. Manipulation and lack of transparency. Many fear that nudges are covert manipulation. The authors counter with John Rawls' publicity principle: any policy that cannot be publicly defended should not be implemented. Effective nudges, like Save More Tomorrow, are always transparent and easy to opt out of. 2. Abuse of power. Both public and private sectors can design nudges for self-interest. The authors acknowledge this, from subliminal advertising to defaults favoring providers. But the solution isn't to eliminate nudges but to design oversight systems and make designers' motives transparent. Loss of individual freedom. On the contrary, nudges don't prohibit anything, they just make it easier to choose correctly. People can still withdraw from default retirement plans, refuse organ donation, or keep old choices. This is soft, flexible paternalism that respects the right to refuse, a form of asymmetric paternalism that helps the vulnerable without bothering the knowledgeable. Doubts about effectiveness and fairness. The authors provide numerous examples showing nudges improve behavior in finance, health, environment, and education. More importantly, well-designed nudges can reduce inequality by supporting the disadvantaged without burdening others. In summary, Chapter 17 not only responds to criticisms but also affirms that nudges are supportive tools, not replacements, for freedom of choice, as long as they are transparent, fair, and rejectable. Chapter 18, The Real Third Way. Concluding the book, Thaler and Sunstein assert that libertarian paternalism is the true third way, transcending the divide between those favoring state control and those advocating absolute freedom. It doesn't aim to expand government but to improve how government helps people make better choices. Their two main points throughout the book are, 1. Choice architecture is ubiquitous and greatly influences human behavior, and 2. We can design this architecture to preserve freedom of choice while helping people live better. Libertarian paternalism appeals to both political sides. Republicans support it for preserving choice and opposing coercive regulations. Democrats find it useful for improving welfare without cumbersome bureaucracy. Real-world evidence is the bipartisan support for the Pension Protection Act of 2006, which enabled automatic savings defaults with minimal administrative costs. The authors argue that old debates between free markets and total control are outdated. In the modern world, where information is complex and choice is abundant, nudges are an effective, flexible, and individual-respecting solution. Instead of imposing or ignoring, nudges show that government can encourage without coercing, design smartly without stripping away choice. This isn't just theory, it's a practical method successfully applied in finance, environment, education, marriage, and healthcare. Chapter 18 ends with hope. When applied correctly, nudges not only improve public policy but also build a more flexible, effective, and humane society.